All right, hello and welcome everyone. My name is Caleb from the Technical Assistance Services Center, or TASC at the National Rural Health Resource Center. I get to introduce Jill and Andy for our session, Advancing Partnerships that Support Southern Arizona Critical Access Hospitals and Rural Health Clinics. Our Arizona State Flex Program and Southern Arizona Hospital Alliance will present their work together to extend and sustain hospital finance and operations for Southern Arizona critical access hospitals and 10 rural health clinics that comprise a healthcare network. They'll share practices, which will include utilizing practice outcomes national database, benchmarking tools, and swing bed network development, along with quality improvement tools and additional resources. At the conclusion, participants should be able to learn about the rural health network development throughout the Southern Arizona project, identify the importance of partnerships developed between two organizations, the Arizona Flex Program and the Southern Arizona Hospital Alliance, to extend resources that support the network, and to understand the process of improving quality metrics by utilizing pond stewardship and growth in the swing bed program. Our speakers today are Andy Shanks and Jill Bullock. Andy has over 20 years of experience in healthcare industry with an expertise in business development, EMS, and rural health. He served as the director of the Southern Arizona Hospital Alliance for the past 4 years. And Jill Bullock has been with the Center for Rural Health and working on the Arizona Flex program since 2011. She has over 25 years of experience working in government and nonprofit entities in healthcare, marketing, and outreach to the underserved. In 2014, Jill became the Flex coordinator, supporting Arizona's 16 critical access hospitals and their 38 affiliated rural health clinics. And in 2015, she was appointed the associate director of the Center for Rural Health. So join me in welcoming both Andy and Jill for our session today.
Thank you, Caleb. Can everybody hear me?
Mm-hmm.
Your thumbs up? Okay. So today we want to talk about our partnership with SAHA, the Southern Arizona Hospital Alliance, and why we decided to put resources in and partner with SAHA. And so I'm going to go to the next slide. Next slide. Come on, there we go. So I'm going to turn this over to Andy and describe what SAHA is.
Thank you, Jill. Thank you, Caleb, for the introduction. Thanks, everybody, for joining us today. Really appreciate the time that you're giving to us. So SAHA, the Southern Arizona Hospital Alliance. A lot of people ask me, what is it? So I just want to take a few minutes and describe, what SAHA is. So SAHA was formed in 2015. It's a partnership between Tucson Medical Center and 4 critical access hospitals in Southeast Arizona. Those include Benson Hospital in Benson, Copper Queen Community Hospital in Bisbee, Mount Graham Regional Medical Center in Safford, and Northern Cochise Community Hospital in Wilcox. Since the conception of SAHA, we have added 2 FQHCs to our partnership, Chiricahua Healthcare, which services Cochise County. They joined in November of 2020, and Mariposa Healthcare, which services Santa Cruz County, joined in July of 2022, so this month. Next slide, Jill.
So I just want to add why we did partner a little bit. So SAHA is working so closely with these 4 hospitals, and we didn't want to step on anybody's toes or reinvent the wheel. And Andy is built this network with these physicians, or with these hospitals. I'm sorry. So he is at these hospitals regularly, and so it made perfect sense to partner and build upon the network that they've built.
Appreciate that, Jill. Thank you. So just to highlight some of the major initiatives that we do within SAHA, we do have 37 major initiatives, but just to highlight a few, we do our swing bed program, RHC development, purchasing, laundry services. We do that to the hospitals only, education and training, telehealth, and clinical protocols. Jill?
So from here on, I'm gonna be asking Andy questions and he's gonna answer them. So to start out, what role does the Arizona Rural Hospital Flexibility Program play in SAHA?
So the Arizona Flex, the Arizona Rural Hospital Association, it is just incredible what we've been able to do. I think, Jill, I met you on my third or fourth day of taking this role. They told me that you were a critical relationship to me, and so I met you and Joyce quite quickly after I started. So what does it do? So really, developing those relationships in Arizona, you made that easy for me, Jill. You introduced me to a lot of folks, not only in Southern Arizona, but throughout the entire state. Us working together really aligns us with the broader state goals. We get to pilot some interesting projects, which we'll talk about here in a little while. You guys are a source of expertise for us. So I punt so many questions to Jill and Joyce. I'm sure every time they see my name pop up in email, they're like, oh, Andy's sending another email. Just because you guys are such that source of expertise for us. And you are a funding source for performance improvement projects. And again, we're going to talk about a few of those here in a little bit.
But not only that, Andy is the eyes and ears with these 4 critical access hospital and vice versa. So we share anything really that's going on to support the hospitals in finance and operations. Excuse me.
Mm-hmm.
Well, if I could just add really quickly on that, is that what we uncovered not too long ago, and Andy introduced it, that he also covers EMS. And so it was a really an exciting opportunity as we, under the Flex program, do work with the EMS, including our level 4 trauma centers, that each of those 4 hospitals are a level 4 trauma center. So that was a wonderful combination that we just sort of uncovered by just seeing Andy's signature in his email. And now we really want to do a lot more with SAHA, focusing in on our trauma centers, on EMS in those rural communities. So I thought I'd put that footnote in there.
That's perfect. Thank you, Joyce. And we continue to uncover things that we're partnering on. So maybe Andy can go more into how does the AzFlex partner with SAHA?
So yeah, we do a lot. Funding projects. You got 2 of our current areas of focus are our RHCs and our swing bed development program. With the RHCs, we use a database called POND. It's the Practice Operations National Database. That's through a company called LilyPad. And so all the information is put into POND, and we can do benchmarking, not only locally, not only state, but nationally. We can look at other RHCs and benchmark, and then we can plan that performance improvement around those benchmarks to help us with that improvement project. And our consulting. So we use Wintergreen. Greg and Jonathan are real experts in not only RHCs but also the swing bed program. So we utilize them to help us with this partnership.
And many of you may not know that Wintergreen is who our Jonathan Pattenberg and Greg Wolf used to be with Stroudwater. So they have ventured off on their own, and SAHA is continuing to work with Wintergreen to support the network activities.
Thank you.
So what are the most important clinical services for SAHA in the rural region?
So that clinical component is so important, Jill. So, really we focus on clinical protocols. We share those clinical protocols amongst all of our hospitals. That really equals great continuity of care. So for instance, when that cardiac patient shows up at Mount Graham Regional Medical Center, they share the same protocols that we do here at TMC. So that way, when that patient is transferred from Mount Graham to TMC, it's very seamless. And so TMC knows what has already happened with that patient because we share those same protocols. We focus on a lot of training and education. Again, that training and education is really geared towards supporting those clinical protocols that we share amongst the organization. We do focus on our swing beds. So that's extremely important in that clinical service to make sure that those swing beds are very utilized and we understand what that specialty service is that those are available at those CAHs. And then better financial performance in the RHCs. Using that PON database, we really do see a great, performance improvement plan put around that using those protocols.
So one of the things that we didn't really discuss was SAHA is the Southern Arizona Hospital Alliance is really out of the Tucson Medical Center. And Tucson Medical Center is a large community hospital in Tucson that is supporting the SAHA efforts. And so this is instead of a banner-like hospital that is opening up all these little hospitals, this is a network that is run under Tucson Medical Center to support these small hospitals. So we really didn't talk about that. And I don't know, Andy, do you want to go a little bit more into that?
Yeah, I think Tucson Medical Center is that tertiary hospital in the Tucson metro area that really, we are the community hospital for Southern Arizona. We really focus a lot of our attention on that rural market. We want to make sure that the rurals have really great access to care, and then get those patients transferred to Tucson Medical Center when necessary for that acute care, and then get them back to that local community for that post-acute care. So we make sure that full circle is really set up nicely for our patients in Southern Arizona.
And that's the importance of the swing bed work that is occurring under the SAHA network. Okay. So, okay.
There we go.
Sorry about that. So what are the biggest challenges that rural health clinics what are the biggest rural health clinic challenges? Sorry about that.
That's okay. So yeah, I think it's, we hear this story across the nation. We hear it locally. That really the biggest challenges has been around COVID, and it just continues to be some of those COVID challenges. Staffing. I mean, how many times have we heard in the last couple of years that staffing is just one of the biggest challenges that our RHCs and our CAHs are facing on a daily basis. And then really adapting to that virtual model of care. COVID really pushed us into that virtual model of care very quickly, and we had to adapt to that. Some clinics were set up really nicely where they had used it previously. They were a little bit more comfortable. And then we had clinics that had never used it and really had to adapt quickly to that virtual care. Those are some of the biggest challenges that we face in our RHCs, Jill.
So what priorities and initiatives do you have for your rural health clinics?
Definitely utilizing that PON database to do some performance improvement. That helps all the way around. Focusing on some training and education. I go out to these RHCs and our CAHs quite regularly and ask those questions. What training and education are you looking for? Where are your gaps? What tools and resources can I bring from my organization, from Tucson Medical Center, to fill those gaps in training and education? Chronic disease management. We do a lot around chronic disease management. We have a person in Cochise County. His name is Jason Zebart. He's very focused on that chronic care management piece. More to come on that. I think next year we'll be able to report out much more on chronic care disease. Ensuring effective access points across Southern Arizona. I mentioned that earlier, and I think it's so critical to make sure that those rural markets have high quality access to healthcare in their local market. And they're not having to travel hours for simple services.
What priorities and initiatives do you have for your swing bed programs?
The swing bed program is critical. Getting those patients back from the tertiary facilities back to that local community is so important. So really to increase that CAH average daily census is important. It's critical for their financial performance to keep that EDC up. Provide post-acute care close to home for patients, and we talked about that just a little bit. So I think it's important to keep highlighting that. Improve outcomes for our post-acute care patients, making sure that we have the right resources available in that local community when those patients get back is critical. So therapy, wound care, infusion, those are all priorities. Utilizing those specialty services at those CAHs. So for instance, one CAH might be really good at wound care, one might be really good at infusion, one might be really good at cancer care. So making sure that we focus on those specialty services and enhance those services as necessary. And then just build that specialty network throughout Southern Arizona. We have been working on telemedicine for quite some time, building that network, making sure that those specialty services are available.
So Andy, do you want to talk about the position that was being developed to support the swing bed programs?
Yeah, so we were looking at a person who could be at the tertiary facilities, and they can identify those patients that could potentially go back to that swing bed program. The challenge there really is COVID related. So making sure that that person can get into the hospitals and get the information that they need to get that back. So Stroudwater at the time, they did an assessment for us utilizing some of the funds, Jill, that you were able to give to us through our grant. And they did that assessment. And one of the things that they came back and said was, we have to go after that business at that tertiary facilities. Well, the case managers, and the thing that we found when we started to dive into this is that those case managers and people who are doing that position at the CAHs, trying to get those swing bed patients, they're doing 3 or 4 jobs. They just don't have the time to go after that business. So really they just take the patients as they kind of come through their system of delivery. So placing that person in the Tucson market to go after those patients and get them back to that local community is what we were after. So we're still pursuing that, kind of working out the kinks there. We do have a job description, and so we're working on making sure that that's filled soon.
And the job description was supported by Stroudwater to really, or reviewed by Stroudwater, not really supported, but to really target or hone in on what exactly is needed for that position, correct?
Yeah, definitely. I think that the consultants, so when Jonathan did that assessment, yeah, he really honed in on that. And I think listening to your consultants, of course, that's why we utilize them, is so important. And so when they identified that as our biggest opportunity, we seized that and started to work on creating something in the Tucson market that could get those patients back to those swing beds.
Great. I think that was important to add that I don't think that too many networks have that opportunity to hire somebody to really bring those patients back to the communities when the small critical access hospitals are inundated and wearing so many hats. So this could just really be a win-win situation for TMC as well as for all of the critical access hospitals.
Definitely. Yes.
So will you be able to demonstrate quantifiable results?
Yeah, there's a couple different ways that we can do that. One is just looking at patient outcomes. As that patient outcomes improve, we know that some of the systems we put into place are working, and we can watch that over the different service lines. So cardiac, neuro, ortho, some of those service lines that we can watch that data and pay attention to those patient outcomes. Partial ownership. So really making sure that we have the closest relationship that we can possibly have to our CAHs. The data shows, and some of the experts in the field say, 5 to 10 years, there will not be such a thing as an independent rural hospital. So definitely making sure that we have a very close relationship so that if anything happens, we're there to help out. And then utilizing POND is the last one I would mention. Using that benchmarking data, looking at that performance improvement. And as we keep adding data into POND, we can show quantifiable results as the years go by.
So in 5 years, how will you know you've been successful?
How in 5 years, such a long time, right? Who knows what 5 years is going to look like, but definitely looking at success, we want to make sure we have expansion and strength of the rural delivery system. As I mentioned earlier, I think really making sure that that access to high quality care in that rural market is critical. Services that can be done in a rural area are provided. So building that specialty network, building upon the services that we have in the rural market is really important. When care is needed in Tucson, it's a seamless and effective experience for our patients. So we know not everything can be done in a rural market, right? So when those patients do come to the Tucson area, we're making sure that it's easy for them to access that care. When patients get frustrated, they won't access that care any longer. They just kind of give up. So and rurals maintain optimal level of operational autonomy. We think that's extremely important. As we build these relationships, we make sure that those rural hospitals feel like they do have that autonomy that they need to function.
So I just want to add, there are 2 hospitals in the system that were on the brink of closure. And so Tucson Medical Center really came in and supported these hospitals in such a way to bring them up financially and help them with staffing, help them with their IT, and keep these rural communities open. And I think that has been so successful, you know, in less than 5 years. So I think that that's a huge success that these communities still have a critical access hospital, because really without the support of SAHA and Tucson Medical Center, those communities would have lost those hospitals. So I don't know if you want to talk more about that, Andy.
Yeah, as we watch lots of presentations, right, and we hear from a lot of experts in the field and across the country. You know, we know that there are lots of rural hospitals that are closing just because they don't have the financial support that they need. So really, as we look at Southern Arizona, we're making sure that those hospitals in our rural markets are strong. They have the specialty services. We're getting patients back to those local community for post-acute care to fill those swing beds. We're making sure that we have the best improvement plan in place to sustain them long term. And if things do turn south, we have a very good relationship with them so that we can have that more in-depth conversation when necessary.
Yeah, thank you. We really are close to the end of our presentation. I know we have some more time. We do have Joyce on. Joyce, do you have anything else that you could add to this?
Hi, everybody. No, I think that's been, Andy's just done a nice job of covering that. And Jill, I'm glad you brought up about what Tucson Medical Center has done to really sustain those hospitals. And it really bodes well for TMC and what they've done, but also for the hospitals. And I think the model of that that feeder system that supports TMC and getting the hospitals that, or the patients that need that more high-tech, more concrete serving of whatever issue they might have and going to TMC. So it's worked at both sides. It sustained our rural community hospitals, but as well as supporting TMC and what they do in their capacity of being a full service and high valued organization. So it really has worked from both ends. So I just wanted to add that footnote on it. It works for both organizations within our rural communities and for TMC. You agree, Andy?
Oh, definitely agree. I cannot thank you enough for the Arizona Flex grant. has just been critical in moving some of our initiatives along, and partnering with Jill and Joyce. It's been an amazing experience. I look forward to the future. And I know that a lot to do here in Southern Arizona. And so doing this partnership is just so critical to making sure that we have sustaining healthcare throughout Southern Arizona. And so Jill, Joyce, thank you so much for everything you've been able to do for us.
And the one other point, what's so key too, is that this is covering 2 counties, and we should have like the range of the area, the square mileage area of both what's the counties, Jill? Cochise County and
Cochise and Graham County.
Graham County. So I mean, the distances are far. And that in itself too just bodes well to what TMC is doing to really support the rural part of our state. So
And our counties are bigger than some states. We only have 15 counties, whereas some states have, 50, 60 counties. But yeah, so it's a vast area.
yeah, I mean, just as an example, to get to Mount Graham, which is in Stafford, Arizona, today, with driving, it's close to 2.5 to 3 hours to get there.
So there is a question of any other of those hospitals participating in swing bed program. To answer that, yes, Michelle, we have hospitals participating in, I think all of our critical access hospitals are either participating or trying to participate in swing bed programs, but not necessarily working with Tucson Medical Center under that.
Right.
A great segue, Jill, into opening our conversation up to any additional questions that we have. Either take yourself off of mute or type it into the chat box, guys.
It's a very creative way to develop a different type of hospital system, because they're not all owned by Tucson Medical Center. Whereas when you see these hospital systems getting support from the mothership, I guess Tucson Medical Center could be like the mothership, but they're not. So it's a really creative way to develop this financial and quality network. And I'd been trying to do that for years under our Flex program, but our hospitals are so diverse here that it just wasn't working. And when this opportunity came up with SAHA, it was perfect to partner with them.
Jill, you actually answered my question. I was going to ask you if this is more like a network of hospitals that are independent, that don't belong to a system, but this is kind of a way to affiliate them to be able to get a group, do group projects and things. So actually you answered my question before I even asked it, but it's very interesting, because I have probably about a third of my hospitals do not belong to a system. And so this might be a good way to get some projects together for them.
Yeah, and Tucson Medical Center, I mean, when Andy talked about they have laundry services for the hospital, they have purchasing services. So, other things are going on other than what Flex is supporting behind the scenes, which makes it so valuable for the hospitals. And they do have, Andy, you can talk about this, they do have a dedicated board for this. It's a true network.
We have a board. All the CEOs sit on that board, along with me. And so then we collaborate, we strategize, we try to find the right initiatives that cover all of our hospitals, and we move those initiatives forward. Great system. Jill, if I might add to the last person's question, to add to that, when we started SAHA, all the hospitals were independent. So forming that relationship was critical to that conversation when the 2 hospitals that are now under the TMC Health umbrella came under financial stress. It was an easy conversation for us to have. It was so important for us, and still is important for us, to be that community hospital. We do not plan on owning any of the hospitals, but it's just worked out that way. And so in the process, we've been able to keep those hospitals open, like Jill said.
And so there's a question from Nick. Do hospitals need to be geographically close or driving distance? Well, that certainly does help. There is nothing close to TMC without rural areas,
No.
but it doesn't work for some of the other critical access hospitals who might be feeding into the Phoenix hospitals. So it is the ones that definitely are feeding into the Tucson market.
Yeah, and I was going to add about our mix here of our critical access hospitals. We have Tribal, Indian Health Service. We have Tribal 638s. We have Banner Health. We have, what's Holy Cross?
Tenant.
Tenant.
And then there's some on the west side. Yeah, so we have this really mix of ownership in our state, which the natural of, turns out that these independent, supported community hospitals sit down here in Southern Arizona. So it was sort of a natural formation, really, and thankful to TMC for leading this and formed this. So
Go ahead, Nick. We can't hear you.
You're off of mute, but we still can't hear you. He's got to grab his headset.
How about
Yep.
now?
Yep.
Mhm.
Okay, sorry, I asking another question, but in my state, I have 20 critical access hospitals, so similar to your size, and I have about 5 that are independent, but they are spread throughout the state, so they're not within driving distance. So you answered my first question, but the second part of it is I tried to regionalize, hospitals that are in the same part, like Western, Eastern North Carolina, and run into problems where some are part of a health system, so they have different problems. They just, and I heard Andy say that in the future, Nate, his estimate or prediction that all rural hospitals should be associated with something, whether it's ownership or health system. And so I get a challenge with that, with different hospitals, different systems. And then the third challenge is a for-profit entity that bought 4 critical access hospitals, and they have them in the same part of the state. So I would love for them to be one region, but I have real problem engaging HCA and their for-profit. And 2 years ago, this health system was nonprofit. So it's a big change for the focus of the hospital, and they're cutting back on services. So I'd like to know, because I heard somebody say Tenet was involved, and I think of Tenet, HCA, HMA as, the big players. I'm wondering how to involve those for-profits when the majority of, I think, hospitals are nonprofit or community owned. I think, at least in North Carolina.
So when we mentioned Tenant, it's interesting because we've got one hospital that is under Tenant that was definitely a non-for-profit and is part of a Catholic agency, which is Carondelet Holy Cross. And somehow they were able to keep partial nonprofit or their Catholic status, but they are the only critical access hospital in the Tenant system. And so it's kind of the redheaded stepchild, I guess. They're not really supported much by Tenant as a critical access hospital because they don't understand them. So my recommendation would be maybe to, like TMC really cares about the rural area and to find out, or the rural hospitals, and to find out if the other hospitals do in such a way that they could support those hospitals. But it is like we said, it's a win-win. These hospitals are feeding into TMC. So they saw the importance of that. So you might want to open the conversation and maybe Andy could speak to them and how it works.
Yeah, definitely. Just to add to that, Nick, what I do when I go to those hospitals that are not part of the SAHA network, I really just try to understand what their gaps and what their issues they're facing and try to fill some of those gaps. And so a lot of training and education, just that relationship building. the one hospital that Jill mentioned does come to me quite often, just for some of the training and education because they're not getting it elsewhere. So, what those rural hospitals and what that rural market is looking for are those tools and resources that they can't access in the area. And so they're looking to those larger metro areas for those tools and resources. And so I think whoever's giving those tools and resources to them, they're more likely to work with. And so that's how I build my relationship with those folks.
And we didn't really go much into quality, and they've got just such an amazing quality department at TMC that shares their knowledge with the small rural hospitals, with the critical access hospitals, and they do an all-day quality symposium, and it's almost like quality 101 for the critical access hospitals and how they're supporting them with quality, because as many of you know, the critical access hospitals kind of grow their own quality departments or quality directors.
And quality is one of the most important things that they want to talk about and that they focus on. And so our quality symposium has grown over the years. I invite the Center for Rural Health to that because Jill and so much information and participate in that conversation. And so they appreciate that. And so having, that one day a year quality symposium is just the start. We do lots of quarterly and sometimes monthly meetings, almost like a peer group where we put all of those to talk about quality because it's such a hot topic. And I go to the rural hospitals, they want to talk about quality. So Jill, thanks for bringing that up. That's a very important point that we did not talk about.
Right.
We had a question come in to the chat box about the pond tool and how you guys got RHCs on board with that, and whether or not you could speak a little bit to the recruitment or outreach methods for that, and if there were difficulty getting the clinics on board.
That was a requirement.
Jill had built that network. Jill, you might talk about it much better than I, but I'll start the conversation by saying Jill had already done a lot of that framework for us. And so when we joined forces, Jill hooked me up with LilyPad Greg from LilyPad, so we could talk about the pond resource. And I was able to go out and kind of talk to it more to my RHCs and say, really, here's the value that we see within using this system. We really want to build this network using our pond data. And so it was a struggle. I have to say there was definitely some growing pains there, but we're finally getting to that plateau point where we have a good amount of data in the system for our first year. And as I said, hopefully building forward, we can really see the improvements with our quality metrics as we're utilizing that pond database.
And Joyce and I had been, mostly Joyce, we were trying to build the pond network or just participation, and we did have struggles along the way. Part of being part of the SAHA network, we sort of made it a requirement to participate in pond and get their data in, and was able to work with them more one-on-one and in getting their data in. And we really, and that helped get more hospitals and more clinics on board with pond to get their data in.
Yeah, it was a struggle. I was an early believer in it, and but it was a challenge. But we had several early adopters around the state, which also really helped. We used them to talk about it at different times. So it's been a process over the years, really many years.
Yes. And you really have to get the leadership of each CAH involved. I took it to our board. And so I took it right to the CEOs of each hospital, and we started to show the value of pond. And so that kind of trickled down for us. And so the RHC managers were definitely more interested once their leadership team got involved in that.
Yeah.
Down to our last handful of minutes, 3 or 4 minutes in our session. What other questions do you guys have for Jill and Andy and Joyce? I think it's a great example of partnership. And to Nick's point, that a different format and structure coming from a hospital to regional hospitals that are not necessarily affiliated directly. It's a great example, guys. This is really neat. Thank you for sharing.
Our pleasure. Thank you for listening. We got a lot of good opportunities to answer questions and hear about this great program.
Yeah, Jill, you had mentioned connecting with other systems. Nick, I would love to connect in North Carolina. I would love to understand, what other systems are doing, what organizations are formed, how we might be able to share some best practices there. So, not sure everybody who's on the call, but my contact information is on the last slide. And I think they're going to share that after we're done with the presentation, but please reach out to me. I'd love to connect.
Yes, absolutely. There's a link to the slides in the chat box that Matt Bancroft put in there. They're also available on the attendee hub. But yes, and we have the opportunity to connect with individuals within the attendee hub. But here are Jill and Andy's slides for a second chance.
Oh, there you are. Are you guys seeing the slide with his?
We do, yes.
Okay. Somehow I don't know where I put you. All right, there we go.
Before everyone escapes, I'm going to let everyone know that we have a break until 2:30. So this session goes until 2:15. We have a break until 2:30 where we will meet as a plenary group to hear about the Flex program core competencies update, where you get to listen to me again, myself, Terry, and Tracy. Talk about the core competency guide for state flex program excellence. I'd like to thank both Jill and Andy again, as well as Joyce, for their presentation on partnerships. This is really great, guys.
Thank you, guys.
Thank you, everyone.
Thanks, guys. We'll see you back at the plenary session for the core competencies update.